Ask Your Pharmacist is brought to you by Dragnet, your #1 online pharmacy, and the Pharmaceutical Society of Ghana, and proudly sponsored by Lita Pharmaceuticals, quality healthcare. With support from Vitsifort, your best vitamin C plus zinc supplement from Samus Pharma.
You are welcome to another week of Ask Your Pharmacist. This is the only health show that is interactive, gives you an expert knowledge about that drug or medication before you swallow it. And I hope by the end of today's discussion, you will be a step closer to living right and being healthy. My name is Peggy Soundone. You can find me on Instagram at Fiery Peggy. And if you missed any of our episodes, go on YouTube at My Pharmacist TV, like, share, comment, and make sure you subscribe. Remember, this show, Ask Your Pharmacist, is proudly brought to you by Dragnet, your #1 online pharmacy. Ubetimia download the Dragnet app no ewo Google Play Store, the App Store. Order all your medication for prescription to so. Edrona doctor natural sokotono for to so. Pharmacist number fro. You would engage with the pharmacist, and whatever be it, they will deliver to you at your doorstep. Dragnet is your mundo for delivering so for. Dragnet is your #1 online pharmacy. This is also brought to you by the Pharmaceutical Society of Ghana. Amicus Humani Generis, pharmacists are indeed friends of the human race. This is also brought to you by Letab Pharmaceutical. Letab at the Letamin. It's a multivitamin and mineral supplement for total strength and vitality, promotes mental performance, and boosts the immune system. It is help us all boost the immune system. No, hope us all stay fit. Now I wish I would and dear and kosuye. Now want to win the fruits and vegetables. Na me pacho supplements are we here. Letamin. Now follow around zinc and so folic acid, iron, and zinc supplements that effectively reduces the risk of iron deficiency, supports immunity, and promote health and wellness. It is so much brassy. No one can say what you say, what posso ya we ya, and for we ya, moje drodie, and one follow around zinc. Into pharmacy be a bear will be a catcher pharmacist, ne say, whoop moje drona, wash and follow around zinc. Let some works sooner draw, a pay, and none is how be fun. Now, wolf and so it is going to help treat intestinal worm infection and help increase nutritional intake. Where do you know would you say to me, you must send your fata. Now, so soon, dear, it to me, it's a your mano quine. Intimate strauss, a female wound the wear me ye. Now, what you wound the wear me, would you wear me at che? Now, to me, say, yari to by heart, and more casanya bebre. Co pharmacy catch a pharmacist, they say, Upesun sooner, drona sooner, draw oceano, Letamox, follow on zinc, and a Letamin. It's available any pharmacy near you. For bulk purchases, please contact Leta Pharmaceuticals on 030-222-4613. Leta Pharmaceuticals, quality healthcare. This show is also supported by the Lady Pharmacist Association of Ghana, LAPAC, and the Young Pharmacist Group, also supported by Vitsifort. It's a sugar-free vitamin C plus zinc supplement. Would you tune and dissolve yes or orange juice na sugar-free obia to mifa. It's good to boost your immunity. For bulk purchases, contact Samus Pharma on 050-164-6494. We are taking a quick break. The show continues. Don't go anywhere.
Kwame, me go office get come for.
Me and me go hospital class and doctor show my chia me.
I go krom so ni krom. And then me so na uti say okwa do. Dragnet ho. Dragnet your online pharmacy. A draw bi o hia bia no. And once I come app no so. For say put me to ho. Dey di lo no e wo fi. And then no ko akra wo. Like sales pharmacist a o mo betimi no ati ko ho. Afa draw bi o hia. Info say ni kan ha no mo no. I'm running over past some customers. Come on, go half on the show. Get you on the fear. Our prescription around. And running on our order. My order in the next 5 minutes. I'm telling you.
That's it.
Yes, you heard right. With Dragnet, life is now made simple. You too can download the Dragnet app on the Play Store or the App Store and experience a world of convenience. Dragnet, your #1 online pharmacy.
Welcome back. You are watching Ask Your Pharmacist. Today we are coming to you from Ogbojo here in the Greater Accra region of Ghana. And our topic for discussion is ear infection. And our guest pharmacist is no other person than Farm Mariam Apreku. She is a pharmacist at HealthLink Hospital. Farm, how you doing?
I'm doing great. You?
I'm doing very well. It's always, amazing doing this with you. And then you can't be for ear infection. Patchana ear infection, no, daddy.
Enti yare ko bi a affect ye ye no. Enti sɛ nea nyina yenim sɛ nea aso no bo ma wo ma na naso ye ne ya. Ebo ma na naso emu dwa no. Ebo ma wo ha na no ampo de ne peko. But ye pese pensem mu ne hwe niema e course and e ban so actions be na say o take and at each point in time no e ba say I wonim say we na e course and even if you don't have any idea we are here to educate you. That's all it is. Okay, so today we are talking about the ear. How do you clean your ears?
I normally use ear cleaner.
What is ear cleaner? Which one is that?
The one with the white cotton.
Okay, so you're talking about the cotton buds, the one that they call you assume. Okay, so how often do you clean your ear?
Early morning, if I bath finish, I normally clean. Evening time, if I bath finish, I normally clean.
That means you clean your ear every day. Okay, so do you know you don't need to clean your ear every day? Because naturally the ear cleans itself. So when it gets to a point where the wax comes out, when you feel that the outside is now a little bit waxy, you know that thing, it's not dirt, it's wax. Your ear produces it to protect your ears. So when you realize that it's coming out, that's when you need the cotton bud and you need to clean only the outer portion. I know it's sweet you when you put it inside, but no. But no, the best thing to do is when it comes outside, you use the cotton bud and use it to clean the very outside edges. Because the more you put that thing inside, you are making yourself prone to infections. I know it's nice, but sometimes you have to control yourself. And it means you are doing it every day. That's not the best. When you see that the wax comes out, then you use the cotton bud or a soft wet cloth and you use it to clean the outside portion. Exactly. The wax is there to protect you, so you don't need to be taking it out all the time.
Okay, what is the best ear drop for ear infection?
So you're asking about a single ear drop. That is best. There are lots of different kinds of ear infections. And the best person to pick an ear drop for every single condition is your pharmacist. You go to your doctor, complain, they might give you a certain medication. You come to the pharmacy, they'll give you the best choice. So there is not a single standard. And you are asking this question so that one day when you have a bad ear infection, you go and buy it. That's self-medication. The one of the diseases that people actually self-medicate a lot on is ear infection. Because we don't think it's a big deal. It's my ear. So they come, me ear drop, and they come and buy. But I can bet you that we have about various kind of medications for the ear that I can count up to 50 of them. Depending on what is wrong with you, you talk to your pharmacist, you explain, and they'll give you the best one. So there is not a single ear drop that is the best. Depending on your situation, and we give you the best. I hope you understand. Thank you.
Thank you too.
Enti mama and they can't ask ho answer. More question be a fast so ho abet me bisa.
Okay, mpaucho. Person bisa say cotton. Duana cotton sheso ne betumi de yi wasum. Ana sent akokon takra. Enu so ye was say you so ana say. Enye say you use.
Emu bia enye sa. The only time I bet me use sa cotton is say wax no. Ade na wasum na enye fin. 10 times enye fin wax e wo ho se be protect waso no se bo ma na adults kakra na epie aba waso na abontin mo so bo mkra hu obi ahu se epie na nenam ho ho na obetime use sa akọtin na ode yi ano ho keke but so wo di wra waso no mu na de ye ni se enyi fin no etimi pia fin ni kra ma ni ko ekire mo na the problems amount intercranic crampo de nka ho kra because sebi omo ya amount for the thing e bi omo de hye omasum ana na asum keka no odi etiti enye kra ti cotton ne de wasum ano ho na na ese odi yi kakra na ebi om kwa wuti nkwala ne de yi omu hinim ni use ano no me pa cho ene ye ka aso ho asem nti wo question be found.
Okay, my question is me was small boy bi na wo hono ma na odin nsa akọ na so a trying say so be bibi wo na so sometimes crying with me and ask but we attend to him and now I'm manager. So I want to find out say no a problem be and I say BB we have to find out a hospital about it.
So that means we did not call hospital. Oh.
In a hospital ma my olive oil me adi so be a week. Later on yes I didn't call but sometimes no one ma now the insano esa akwana so. So
Okay, nti say omoma olive oil, that means na a condition be a omo friend wax no. Ade na yet in time na wasum na yehu ni say ye fin na nye fin. Waso na ne produces our wax no. Na a protect waso no. But obu oma o produce too much of the wax. Nti won say na afi de aye dendenden won asum. Aye dendenden won asum a na afi de infection so de ne ho agim. Nti de enti omoma olive oil ni so the olive oil ni so mo a na ama wax na ye mremremre. Ti wo de ne ko bi ma na o ma wash mama. But problem ni say enya start say pe bon say na kakra na aba bebre. Ti bon say wan ha be ya de e be wo ne ho kakra. Ti the moment o be start ayesa na che say e bia e time say mo mama mani akon ni asan ko wash mama because obo ma e ba sa na fe de na ye denden de afi de na suma ye dududu kasa kra won ti papa. This oko wash sana akwa nti ebia ya ade a starting ti mo hu ne ntam ni de ye ti the moment of best start ya sana na mo hu say it's time say bia mo de ne beko mo be di nkan de olive oil na so na so ma ahwe say betimi asane epia etimi sane epia na ne ho han na fine but wo monitor na hu say enye ya na wasan de na kono ma wo hye ma hwe ama no why.
okay, all right. Any me that sense.
Me da say
Okay, nti edie to me causes ear infection because me bia to me da. To me ya me yans me so me nyo obi ametande in your masum. So what are some of the causes of these ear infections?
okay, so basically it's bacteria. Bacteria can cause that. And also we have a situation where we have some instances where we have fungal infections in the ear, and there are some instances to where there are inflammations. You can say inflammation that means bibi na ahono or wasunimu and ti ebetimi aba so obi o made bia no or allergies. You can allergies a obi o tanya cold bia enyem nwa se de bia na so be ne ya because you hwa wasone wo hwene no nyina aye connected nti de bia say when your infection or ha area na it may travel call wasum and inflammation can occur especially if you are having allergies a lot and also for no reason na tanya pompo timi sabi etimi bo wa motuom no sana pompo betimi abo wasum enti eno so timi cause ear pain or infections enti eno bi no no
Once obi wo ho say otumi de ne nsa hye na sum no ye sa dede no che say obi na no ho ato no te enu say to me part of ear infection ni bia na
eno ne allergies basically eno ye allergies basically but sani ameka no so wo allergies bebre na etimi affect we ear probability so ubenya ear infections ne high because ekeka no so odi bibi nunum no oye sa sound na ne ho ato no they say baby keka no wetitin sa na tie but enti ne ka say enye baby a na keka wa say wetitin and say when you keka na utitin bebre a ebema weni na aye kro sa na wason so tie.
Okay, so let's talk about some misconception. You to me catch so oh nipa wo ho so to me you assume wo hu inte so di run afa e fi na be free mu aba na no che say waso na ye clean. But I know say to be so to me yeah, it to me den so so eba. What do you have to say about that?
It's naturally Nyankopon bo was in such a way say it produces our wax no sa wax ade in time Nyankopon eye in such a way say e be clean wa wasunu and na e ba bebra and no answer ye hu say itimi so ni pie and only that's the point yes if e be a soft cloth ye damp now they are paper ideally any kwan so the bibia ra wasumuda but ye dey share hu say wasuma ye finti enye fin wax it is there to protect you. It only becomes a problem when you are overproducing it and the no dey just only ENT specialist can bibi no mo de be ma wa now regularly ube ko no mo a wo mu ama but so realize say wax na ba bebre all the time and remember the more we need the more e beba because we are body ni per se protecting the huntie san be manaba enti men ka say me de enche na masuma ye fin da bi we are body ni be ka say we yinti from bra enti enye fin wax.
Okay, obi so ho no bo na nyoma fita efri na sumu eba eno nso no obi wo aka so mi so nyina ye de wo me enti ear infection ye de wo ana
yeah ear infection found the point is especially so who are insufita and they are purely an infection. It could be fungal, it could be bacteria, or it could be mixed. What you say? And he say insuo ni fini ba that means a crow bi wo ho. Yen nyina yin say a crow ba wo nan kra na wonhwe kro ni a insu fin free mu ba. Say nyina yin sa. Enam sa waso no baby e wo ho no nti a crow ho a wontimi hwe so ye no. A crow ni timi e kese na emu free insu fin. E bo am kra na service cent e di echire. Enti so wo hu insu fita a eno kra de wontimi ntwentwen so kra. When you're infection, you need to rush to see your pharmacist. You need to see your doctor. Go who ENT specialist. And I oboma kasi the one it's not because say oboma wa ma infection at na ne ho che from nkwala brem. And yes, who say nkwala pa no mta nya ear infections, especially nkwala ye mo munufo. Because I catch us say aduane we num ne wo hwene ne waso ne connected. So ma akwala nufo a eboma nufu nsuo ne bitimi san ne corner sum. Send your boy my old my tiny don't be home, my crown for credit me funny hinimu pay, especially on maid door. A bit funny hinimu pay, that means a bit to be corner sum. And remember, say a nufun so a milk, a bit of Gina Suma, obenya infection on us. Something Qualano will say, a tie and it's now come infection be. At nana sunu mache. Bon say I for ne o mani nko ho bebre. And na kranika say ne ya and obeka say ne ya nti o nkrani ntimi voice ni out. Bo say na aka ne ho. Na akwa akoma ekro kese won asum. And na one hwe ya betimi ama ne whole lot of infection na fe de smells cry efri ni hwini mu ba. Etimi sama ne halitosis. Nti halitosis ni ye say nka ewo ne num kra. Nti ear infection no ye mfa wo, but a starting time na one hwe ni ya etimi ka wo ho. That's basic.
Alrighty, yen kwajen krato kakra. When we come back, we will talk about tekrena what the rubber fa huna what the fa wasum. Say yes, say enye, and the best way to treat ear infection. We'll be right back.
Coffee now or hey, a sharp on to an asio.
Madame Yario, and I am renty, minting PM Cotedro.
Oh, coffee, and an hour how home. Uber to me at all, no, you know, what dragnet up no so I won't 209.
Dragnet?
Ah, name dragnet, me, hammy home be a woo. And one is a macro up no so na children ram here, you know. And now my friend pharmacist no na many, or the rolling in our bremen, I watch me 5 CDs pet.
And yes, where the mammy want to be put at that?
Emerson. Also download the Dragnet app free Google Play Store and now App Store nenya ahoto so papa bi. Dragnet app bear for the tombia edi kankra.
Welcome back. You are watching Ask Your Pharmacist. Today we are discussing ear infection with Farm Mariam Apreku. So Farm, we left off talking about, how or the causes of ear infection. Se sian me pese ye kan bibi efa takra ne rob na ye de fa ho. Ghana ho bi to be share akwa takra shopping. Wo hu no ne nam. O se me pe akokwa e bia na oye bema na ne kala yese. Na we yi hu fefefe no de ntosu aka. No atam rob no de afa ho. Na se odu nu na suma na aso eno na ya na se enye.
Rob ne cry come in TB down. That's the first. Into a crying so I say when said young cocoa no TB cry. And see people use various other means. It could be anything. It could be their pen. It could be a stick lying around. Sometimes even toothpicks. It's that bad. They need something in their ears. Mekoba said they be our sumo kikawa. That means there is a problem. It could be allergies. So we will be a winning kikawa probability say wasumo bekika all the time and so it happen. You need to speak to your pharmacist. Sometimes you just could need allergy pills. That's all. But so one when you are na one who pharmacist and now doctor no man handle amawa. Na de be out the sanya money we wasuma. Sanya mekaino. A cron kitten near prank kitten be baba unhuni but a honey a delicate a muye mere into infection beba. Wouldn't a cranny ra wasumu, sending our kind of the num. Baby, any a body bacteria will be bracing your num. That's the fact. Yeah, because you no crown bacteria be brain war. And you introduce it into your ear. That's bad.
Okay. All right. I want us to really go more into details about medication treatment, Me gidi pan say ear infection say na okan e dose bebre, but treatment wo and can it be very deadly too?
Well, it can be deadly. Sending I be a woka say be a ear infection. But man, as soon on fan any serious. But it's one of the most painful form of infections. Was soon ya one hair won't mean that. That is when it becomes very bad. And I who say ya sono Say na make an and connected to nearby baby. This all my infection be cha e was ma. It's you know say it's mirror bloodstream. And if it gets into your bloodstream, it becomes something else. It can start in your ear and it can end up somewhere else. So that's also one thing. But when it comes to the medications, trust me, the best person you can speak to about your ear medications is your pharmacist. Ebo ma unhia antibiotics. So as soon as you can, ebo ma na unhia some anti-allergies. Ebo mo so ay infection so a enye de odi beto so wasum nko because ebo ma oya na adwen say ear drops no here. But ebo ma waso ne cry you need pills. Say bia wasum bibia hono wasum a eardrop onye ne hwe, but you need maybe antibiotic pills which will help infections in the ear. And antibiotic pills bia na etimi ku asumukro. We have specific ones for that. It's only pharmacists, kasa, no doctor kasa. They will pick those ones for you. They are special. I can mention them here because who mention that people will abuse it.
Okay, so farm, is it possible, say, some medications are in drobi, able to trigger some ear issues, Anna?
Yes, so a typical example of a drug that can give you ear issues, gentamicin. It's an antibiotic. And usually, that's how come sometimes some people become deaf when they are young, especially if they have maybe a meningitis infection and their body is born, they are children and you know they have delicate ear organs. So they bombard them with a lot of antibiotics in order to save their lives. But the side effect of those drugs is that it will destroy your ear, a portion of your ear, so you become deaf. So sometimes when the child is young and if you are not vaccinating the children as you should, or unfortunately they come in contact with maybe an infection and they get cerebrospinal meningitis, they will have to give them certain medications and you have to make that choice that your child will have to be deaf before their lives will be saved. So that's one aspect of it. So gentamicin can do that. And there is a medication that you can take to that all of a sudden obema say ojina na so ye ne chan ebo ma edro timi courses a ebo mo so a naturally no body no bibi nkoye kakra na ema osa reactions no the frey yare bi vitiligo disorder enti de bia sa nipa no neni subrain is because say when you disorder be woni ear anymore causing it not to be stable enti de bia ogina na neni subrain say obehwe from no disorder of the ear see ebo amkra when su na brew why do you cry cause say there is a problem with your ear what you say. Enti no ko hu pharmacist ko hu doctor ko hu specialist obemo hu say there's a problem with your ear enti na we need to bro no
Nti se when you super anya se bia omoja na aba for anya come na ede o sugar level na o low waso so betumi akose sa
is and also ehye ho baby we usually not talk about because entirely I remember vitiligo ne bo ma etimi ewo ebusuamu kakra enti no omo we dro bia enti ankofo no sa problem na ye de ma omo na it must stabilize almost senior ni sumbre no.
Okay, this has been very educated and interactive. What are your final words to our viewers?
So my final words, you might think it's just a basic ear infection. Sometimes it's not just an ear infection. Sometimes something else is causing it. And if it is, why don't you speak to your pharmacist, speak to your doctor, handle it, especially with the kids. With the kids, it's so rampant, but we don't deal with it. About my craving, we think say malaria drama. About my ear infection, a simple ear infection, which an eardrop can help. Talk to your pharmacist. Let them examine the children. Go to the hospital. Let them examine the children. Take care of your ear. It's something that it's like your eye. If you lose your ear, you've lost your ear. The same way, if you lose your eye, you can't get it back. The ear too should be protected. Should be taken care of the same way you take care of your skin, the same way you take care of your eye, the same way you take care of your body. Let's take care of our ears. You only have two canals. Yes. I can't say you have only one ear, but at least you need to take care of both of them. And if you do, it's fine.
Well, I definitely agree. The beauty of life is being able to hear and see. Please take care of that ear before it becomes a problem. Thank you so much for sticking with us. Dose for Healthy Living is up next. Stay tuned.
Today on Dose for Healthy Living, be wary of drug interactions. Inform your pharmacist of all the medications you are taking, including over-the-counter medications, vitamins, supplements, and herbal drugs. This will help your pharmacist to identify any potential drug interactions.
unfortunately, this is where we draw today's curtain of Ask Your Pharmacist. I really hope you enjoyed today's discussion on ear infection. Wasu wo he se ka se ya wo ya che se ohunam nyina wuti nyina tuma wa ba bro nyina ra eye basa. So I hope that today's discussion is going to help you stay right and live right. Remember, this show Ask Your Pharmacist was brought to you by Dragnet, your #1 online pharmacy. Dragnet assures you of quality, convenience, and affordable drugs wherever you are. Put that prescription on the Dragnet app on the Google Play Store, the app store. Download it right now. Pharmacists will talk to you, and whatever be it, they will deliver it to you at your doorstep. Dragnet is your #1 online pharmacy. This was also brought to you by the Pharmaceutical Society of Ghana. Amicus Humani Generis. Pharmacists are indeed friends of the human race. This was also brought to you by Letta Pharmaceutical. With Lettamin, it is a multivitamin and mineral supplement for total strength and vitality, promotes mental performance, and boosts the immune system. So if you are looking to take the best supplement for total strength and vitality, go to the nearest pharmacy near you. Tell the pharmacist you want Lettamin. Eshemu 30, they be no afabako. And sign at just 2 weeks later, na want to cry. Folaron zinc, it's a folic acid, iron, and zinc supplement that effectively reduces the risk of iron deficiency, supports immunity, and promotes health and wellness. Miss Rowe, so umoja brase. Na wankasa wahwe say umoja no waye wafendro bebre and to me peja level na. Me pacho we dra wo hia ne Folaron zinc. Lettermox sunsun edro ehyemu baako pe. It's good for the family, it's good to fight intestinal worm infection, and helps to increase nutritional intake. We duani die ho hia. Wo didi e say duani dro na tumi ye adwuma. Na se sunsun wo ho honam a entumi emma saa emba so ntimi sraw. Se wo hwe na wo di wa me ya cha. Catch a pharmacist ne say wo pe Lettermox. Na Lettermox, Litamin, and a Folaron zinc. It's available in any pharmacy near you. For bulk purchases, contact Letta Pharmaceuticals on 030-222-4613. Letta Pharmaceuticals, quality healthcare. This show was also brought to you by the Lady Pharmacists Association of Ghana, LAPAC, and the Young Pharmacists Group. This was also brought to you by Vitsifort. It's a vitamin C supplement, has zinc, and is sugar-free. It's good for the whole family. It's good for everybody. And you can get this from Samuel's Pharma. Contact them on 050-646494. Like I always say, whatever that goes in you is merely irreversible. More to the reason, you always have to ask that pharmacist. Ask your pharmacist before you swallow that pill. My name is Peggy Sanwan. You can find me on Instagram at FieryPeggy, and you can stay updated with all of our videos on YouTube at My Pharmacist TV. I'll be coming your way same time next week. Until then, be safe, be kind, and stay healthy. Bye-bye for now.
Ask Your Pharmacist was brought to you by Dragnet, your #1 online pharmacy, and the Pharmaceutical Society of Ghana, and proudly sponsored by Lita Pharmaceuticals. Lita Pharmaceuticals, quality healthcare. With support from Vitsifort, your best vitamin C plus zinc supplement from Samuel's Pharma.